Harry Kane, representing Cabinet Secretary for Education, Science and Technology, Professor J.T. Kane. Our Vice Chancellor, who's being represented here by the Acting Deputy Vice Chancellor, Academic Affairs, Professor Henry Butol. The CEO KNH, who was represented by Dr. Mona. Dr. Mona himself, the Deputy Director, Clinical Services at KNH. The deans, directors, heads of departments, distinguished and invited guests, members of the organizing committee of this conference, colleagues, scientists, ladies and gentlemen. I will paraphrase my remarks because some of the issues have been talked and because of pressure of time. But I wish to tell you good morning. It gives me great pleasure to extend a warm welcome to you all, especially in the prevailing cold environment. You're welcome to this second International Scientific Conference, which to me is doing well than the chair of the organizing committee thinks, because these things have a way of going down before they go up and steady and plateau. This is a conference, as it has been stated, being jointly hosted by KNH and the College of Health Sciences. It's a conference that gives you opportunity to listen and interact with the researchers presenting on a wide range of their research findings, from the basic sciences, if we have seen the program, HIV/AIDS, operational research, clinical interventional outcomes, culture and health, sexuality, malignancies, and even our core business of training professionals, among other issues that you'll be listening to. These rich presentations is being available at the plenary lectures and in the breakaway track meetings. Mine is to request that you give each of them deep investigation. In case that's why you are a scientist, you need to appreciate. We do research for a number of reasons. One of them is to improve our CV, so you can say I have a thicker CV than so and so. And also to internationalize ourselves. Because the findings, we are creating knowledge. So we create basic knowledge which can be further exploited. We also carry out operational research in order to improve on what we do. In other words, really, to inform us do better what we are usually doing. And this is very important, especially in the field of healthcare delivery. We create interventions from the simple things we do, the research we do, the outreach activities, etc., to alleviate morbidity and mortality within our community. We do also synthesize knowledge and formulate policies which guide formulation of guidelines and informs other activities to be done by the government. Those of you who belong to this college, you know this, but as a college working within KNH, we pride ourselves as being at the forefront in generating and applying health care knowledge in this country. And specifically in the University of Nairobi, we take the flag in helping the university to meet its targets of research output. It is gratifying to note that we have many researchers assembled here this morning. They are from the College of Health Science itself, I see some from Kibwage, from the bigger university community, from the national research other institutions, and also internationally, who have taken time to come and present and share their findings and experiences at this conference. Ladies and gentlemen, that is a testimony that this scientific conference has a future which we need to nurture by encouraging comprehensive research findings being discussed and value being added to the way we do our business. I thank you all and wish you a fruitful participation as the conference goes on. And it's now my pleasure to invite Professor Mutoro, representing the Vice Chancellor, to make his remarks and invite the chief guests to address the conference. Thank you.
Thank you. Thank you very much, Professor.